This Recover Northwest special is sponsored by Regions Blue Cross Blue Shield of Oregon.
Our whole community is in recovery from the stress and pressures of the pandemic. It's relentless. And just when it seemed that COVID-19 was loosening its grip on our daily lives, it surged back and we lost control again. A vicious cycle that many in the addiction community know all too well.
Groundhog's Day. Get up, go use, go find drugs.
I was more than hopeless. It took a lot to get where I am today.
Mental health and addiction issues can feed off each other.
We don't have a vaccination for addiction. We don't have a cure for addiction, but community is the antidote. It's what helps us each strengthen our own recovery.
But stories of support are emerging, both from people in addiction recovery and from the larger pandemic as a whole. Tonight, you'll hear from people pulling themselves up through local services focused on treatment.
As our community as a whole begins the process of reclaiming our lives from the pandemic, what can we learn from those who are already deep into the process of recovery? Your questions will be answered about how we move forward. Our Recover Northwest Town Hall COVID Recovery starts right now.
Thank you, everybody, for joining us for this very special town hall on COVID and recovery. I'm Steve Dunn. In the past years, Recover Northwest has focused absolutely on the opioid epidemic and addiction recovery. But the past 18 months have taken a toll on all of us, and many of us are still dealing with fallout from a multitude of things that we have encountered. Over the next hour here, we'll hear from experts and panelists about how we can heal and recover. And we're not only talking about addiction recovery today, but also mental health recovery amid the pandemic, which has lasted longer than any of us expected. At the bottom of your screen tonight, you'll see the number for the National Lifeline. That's a hotline where mental health experts are standing by to talk about anything you need help with. We'll keep it scrolling for the entire hour tonight. Good idea to write it down and keep it on hand in case you might ever need it. The experts joining us tonight are, we've got them here, Tony Vesna, Executive Director of the Fourth Dimension Recovery and the Alcohol and Drug Policy Commission Chair. Also, we've got Deborah Diedrichson, Director of Crisis Line Operations at Lines for Life, and Dr. Frederick D. Staten, Addiction Services Manager for Multnomah County Behavioral Health. But that is not all. We also have my colleague Deb Knapp is here as well. I'll be talking to some of our guests who have some questions. You'll be handling some social media as well, Deb. Take it away.
Well, in fact, we do have a series of guests that will be here that we will be able to talk to and hear from. They will have a mixture of questions ranging from addiction to mental health concerns as the pandemic pushes on. The panel is made up of people from different walks of life. We're going to hear from them throughout the town hall. Steve?
All right, Deborah, thank you very much. We want to begin our first question because we've got lots of them, and we're going to begin with this from mental health perspective. What kind of toll has the pandemic taken on the community? Because if you talk to folks out there, a lot of people affected by this. And I want to bring in Tony Vesna first of all. Let's talk about things from your perspective in the addiction recovery community. What's the impact 18 or so months into this pandemic, Tony?
Yeah, first of all, I just want to say thank you so much for having this conversation and continuing this conversation. I think it's a real testimony to where the public wants to see addiction go as far as, making a priority for recovery. I mean, everybody knows that the pandemic's been really hard, and one of the key parts of being in recovery for a lot of people like myself is to find that community. You transition out of your life of using and isolation. A lot of times you're really beat down, and then you're caught in this web of recovering people, and they really help to uplift you and maintain your recovery as you battle your demons and stuff. So COVID forced everybody in the house, and it caused a lot of economic stress, and those things really increased substance use rates, increased overdoses. We know Oregon had about a 30% or 36% increase in overdose deaths since the onset of COVID. Just in Marion County alone in the last year, their overdose deaths tripled so far compared to last year. And they've had 90 people die, and so it's been rough. But at the same time, there's been a lot of hope. There's been a lot of people coming together to create innovative ways to address the addiction epidemic in an unprecedented way.
All right, Tony Vesna, thank you again for coming on the program. We'll be talking to you over the next hour. I want to bring in Dr. Jim Polo and talk about the broader sense here, because we know a lot of folks not in that addiction spectrum that have been affected by all this. And Dr. Polo, talk about that as far as mental health goes.
Yeah, I think it's important to recognize that all of us are actually being impacted by all the issues related to the pandemic and the uncertainty of where things are going. You know, prior to the pandemic, back in February of 2020, most statistics demonstrated that on average about 10 to 12% of the adult population was reporting feeling stressed, anxious, depressed. Today in Oregon, it's between 30 and 40%. So a 3 times increase of people basically reporting stress and anxiety. And what Tony was highlighting was when it comes to addiction, the triggers of isolation, the challenges with finances and so forth, that just really, you know, kind of exposes them to potentially having challenges again. So we're seeing challenges both in the mental health arena as well as the substance abuse arena.
Right, Dr. Polo, having a couple of issues with your picture, but we're hearing your voice, and that's the important part. So we'll talk to you very soon. Thank you for that. Deborah Knapp standing by with some questions now. Deborah, go ahead.
Steve, as Dr. Polo just mentioned, this is affecting so many people. The recovery from what the COVID pandemic has put us through is also affecting our kids. And so I want to take us to our first panelist who's joining us by Zoom, and that's Gabriella Simpebois. She is a sophomore at Henrietta Lacks High School, also editor-in-chief of the school newspaper. And again, this is really affecting our young people in our community. So I want to go to Gabriella and ask, what are you thinking? What questions do you want to ask our experts tonight?
First of all, thank you for having me on here. And the question I have is, how do we cope with everything that's happened in the pandemic?
Steve?
It's certainly a broad question, and a lot of folks here. Let's get over to Frederick State, an addiction services manager at Multnomah County Behavioral Health. And that certainly is a broad question, but it's a question that a lot of folks have right now. You heard it. How do we deal with everything that's going on now with the pandemic, sir?
Well, thank you for the opportunity to be here. And Gabriella, thank you for your question. I think, and I'll take something out of the recovery community and say the way we sort of get through this, sometimes it's one day at a time. The last 18 months have been really challenging. Sometimes one day at a time, sometimes it's 1 hour at a time, sometimes it's 1 second at a time. But we talk a lot in our field about mindfulness and staying really fully present, which is really hard when you have just a myriad of things that are going on in our communities and around us. So I would say absolutely reach out for help. I think one of the things that we've seen during this time is we're forced into a level of isolation, right? And so as people were not able to say goodbye to loved ones or visit friends or family or even go to school, we've really felt that. And so I would say take things one day at a time, absolutely reach out for help if you need it, because there's people that will reach back if you feel like you need help. And the other thing is just remember that you are not alone. Everyone is experiencing this time, everyone is. Not just people that we're serving through providers and through Multnomah County, but as service providers, we're also experiencing this time. So the level of empathy and awareness right now is higher than I've ever really seen it. And so I would say, Gabriella, just hang in there, continue to reach out if you feel like you want or need help. Know that you are not alone. Sometimes we do have to take this one day at a time, sometimes 1 minute, sometimes 1 hour, sometimes 1 second at a time. And I would also say just we are all in this together. As a community, we're all fighting this. And so just know that you are not alone and we're all going to get through this together.
Dr. Staten, before you go, I have a quick question for you. Are you seeing more people now coming to you with mental health issues since the pandemic began than you ever have in your career?
I would say yes. I would also say that one of the things that I would really encourage us to think about too is the intersectionality. There's times where we talk about substance use disorder and mental health challenges as being mutually exclusive. They're not always mutually exclusive. Sometimes they're mutually inclusive. And so if people are experiencing more isolation, I'll give you an example, the Multnomah County call center, right? We were getting more calls before COVID hit. And the reason why we're getting more calls is because as people were interacting and seeing one another, then you could have on your radar who was feeling more challenged in our communities. And so people really were having mental health challenges in isolation for so long. And so now we're getting more insight, we're getting a little bit more awareness about it. But I think the level of what we call acuity, or the level of challenge that people are experiencing is definitely higher than what I've ever seen. And I'm in my 24th year of service delivery and behavioral health.
Dr. Staten, thank you very much. Many more questions to come from our guest tonight and the answers from our experts when our town hall continues after this. Welcome back to Recover Northwest Town Hall COVID Recovery. We're talking about not only the addiction spectrum, but also mental health as a community overall. We've got some more questions now. Let's go back to my colleague, Deb Knapp.
Well,
Deb?
Steve, you and I are both parents, and we know COVID is affecting all of us as adults, but also our kids, and helping them cope through this has been a big part of the equation. I want to go now to Bailey Cunningham, who's actually joined with her mom tonight, Becca Cunningham. Bailey is a senior at Henrietta Lacks High School. That's in the Evergreen School District. So thank you both for joining us. Bailey, let's start with your question, then we'll come to your mom.
My question is, what is the best way for us as students to help support our friends who might be struggling with mental health issues due to COVID?
What is the best way for students to help friends who are struggling with issues with COVID right now? Steve?
Deborah, thank you. Perfect person to answer that. Deborah Diedrichsen, the director of the Crisis Line Operations Lines for Life. I'm sure you get a lot of calls. I would imagine some are calling and they are teenagers, as a matter of fact. Deborah, what advice do you have for her and others who may call your crisis lines?
I think if you're concerned about a friend, really just reaching out and letting them know, I'm thinking of you, understanding that it's okay to not be okay, like giving that message, especially now, like we are all being impacted by the stress of COVID and all the things that are coming along with it. And I think that if you can reach out to someone and just be like, I know this is so hard, I understand what you're going through, I understand you're feeling sad or you're feeling lonely or you're feeling stressed, and it's okay to talk about it. And I also, if you do have any serious concerns, our youth line is available 24/7. There's someone here answering calls on the youth line, and every day from 4 p.m. to 10 p.m. we have teenagers who are trained peer support folks. They're trained peer leaders, and you can reach out by phone or text to another teen, because sometimes it's easier just to talk to another teen about what's on your mind.
Exactly right, Deborah. We've certainly noticed that throughout the pandemic. Communication, we've missed a lot of it as we've all been shut down in so many different ways, but it's absolutely the key to talk to someone if you need it. Let's go back to Deb Knapp now,
Okay,
Deborah.
we will get back to Bailey's mom, Becca, in just a bit, but in the meantime, I want to turn to Mike Newell, who battled addiction most of his life and has a critical question on how we're dealing with this COVID situation. Mike?
Yeah, thank you, guys. So my question is, as COVID places lockdown closures and different regulations on how we're allowed to meet, what government resources are available to those who are seeking educational or different, like, workout services for people who need help in addiction?
That might be a question for Tony. Tony, did you hear his question? Are you able to answer that at all?
Yeah, I did. I got a little feedback, but it sounded like he was asking about, alternative in-person services, for recovery and treatment. And, there's a lot of different things that happen really rapidly. Some of the AA fellowships, NA fellowships, stuff like that, they rapidly went to online meetings. And you could Google that and look for different, 12-step meetings online. And there's tons of them. And in a way, it's kind of cool because it really expanded connectivity across the globe because all these people started using online meetings. Now, there's a lot of people who said, hey, that doesn't work for us. There's some other cool stuff like that the Alano Club does. I think you referenced something about working out. And the Alano Club of Portland partners with a CrossFit gym, and they do CrossFit recovery stuff called the Recovery Gym. And I know for a while they were having online like training sessions where people were like working out at home, like squatting and deadlifting like broomsticks with buckets of water on them or whatever, which was really, really cool. And then, you know, maybe as far as the treatment side go or the government side goes of things, maybe Frederick could answer about some of the resources available in the county for online support.
Can we do that? Do we have time? Can we switch on over to Frederick and ask him that very question? Okay, Frederick, I think you heard him. He's throwing you the football here. They're looking for services, this young man, Mike is, and others. By the way, we want to congratulate Mike. 2 years sober next month. So congrats to you, Mike, as well. But go ahead, take it away, Frederick.
That's a big deal too. So congratulations about that. So part of my role is Multnomah County does some of the contract holding for providers that are in the community. And so one of the things that we're really working on doing is working with providers and trying to find out where the gaps might be. For example, if providers are interested in doing treatment modalities, if they need help with some levels of resource management to help with doing telehealth or whatever that is, we try to work very closely with providers. And so even though from the addiction side of things, even though Multnomah County does do mental health, on the addiction side of things, I would say that we're going to work with providers to make sure that they get what they need so we can maximize the effectiveness of services. I don't know if that's a great answer, but part of my role and part of what I do is really work with those providers on making sure that they're getting what they need contractually so they can provide the best services possible. For any other questions, please reach out to Behavioral Health Division. We'd be more than happy to give more specifics, but that would be my answer for the time being.
Good answer, Mike. Hopefully you got the answer you were looking for. We'll continue this discussion at our town hall, Recover Northwest, after this. Recover Northwest Town Hall, COVID recovery. Welcome back, everybody. We're getting lots of good questions from our guests tonight for our experts, and Deb Knapp standing by with more. Deborah?
I love the diversity of our guests this evening. In fact, our next guest I want to introduce to you is Wendy Niskanen. She is an RN, a mother, a grandmother. She was a school nurse and educator. So, Wendy, what is your question for our panel tonight?
What are some thoughts and strategies around how people can reframe their thinking during the time of increasing pandemic fatigue to promote their behavioral health?
Reframing the thinking, I think was the question, right, Deb Knapp?
Yes, it is.
Okay, let's go to Jim Pullo again. Dr. Pullo, any thoughts on that, sir?
Yeah, first of all, that's a great question. I think there's two things that everybody can do. The first thing is when you're thinking about anything that's creating a challenge or a problem for you, look at the good side of things. Try to think about what's behind whatever it is that you're struggling with. What's the part that's good that you can focus on, or the silver lining that might help you at least mitigate some of the feelings of whatever it is that's going on. I think the second thing that people can do is really kind of be thankful for the things that we normally don't think about, that we can be thankful for. Because right now what's going on is there's a tremendous amount of uncertainty. And so it's really easy to get bogged down about all the potential what ifs and all the potential things that are coming that might happen. And rather than focusing on that, think about the things that you do control. Think about the things that are right in front of you and be thankful for what you do have. And that will help reframe you so that you're a little bit more optimistic in your outlook. And allow you to make it through each challenge a little bit easier.
Great advice, Dr. Polo. I think right now so many of us, when we think about the pandemic and the effect it's had on all of us in the community, it really weighs you down. So it's important to take that deep breath and think about all the good things that are out there. Let's go back to Deb Knapp now. Deb.
Our guests have varying backgrounds and education as well. I want to introduce you to Brian Holman, who's an addiction-based induction therapist at Treehouse. He's also a father and 3 years sober. So, Brian, what is your question tonight?
Yeah, I'm curious what's being done to address homelessness, because it's hard for people without basic needs being met to focus on addressing mental health as well as addiction in the first place.
An issue that we've seen increase in our community, definitely. Steve?
Let's go back to Dr. Staten. And I know I'm kind of throwing you out there, not sure if you have an answer for this, sir, but I'm not sure if any of our panelists can address homelessness specifically, but I thought because you are in the Multnomah County Behavioral Health that you might have some knowledge of his question there.
Sure, and I just want to just kind of clean up a couple things that I said earlier. I mentioned the addiction side of things, but if this was from Mike actually. If there were questions about services within Multnomah County, you can always call the Multnomah County call center 503-988-4888. And if you have questions about services in our community, that's something that we could definitely help you with at that point. I think this almost gets back to what I was talking about earlier with the intersectionality. It's really hard to have discussions about how do we mitigate substance use disorder when we're not talking about, well, where do people live, and employment, and mental health challenges, and life challenges. And so what are we doing around housing? Of course, Measure 110 is trying to focus on us using and utilizing mental health or substance use disorder services differently, looking more again at the totality and holistic ways that we're serving people. We cannot just continue just to talk about substance use disorder. We can't just talk about behavioral health without talking about how it interacts with housing and without talking about how it interacts with employment. So the conversations are changing, they're evolving, but to be honest with you, I think the real next step is really to have those conversations where we're intentionally talking about the intersections between housing and substance use disorder. Because as we're seeing a rise in people experiencing homelessness, it may not be a direct correlation, but people are feeling challenged. And so substance use also rises very often. And so I don't have a perfect answer, but I would say that one of the approaches is to make sure that we are talking about substance use, mental health, housing, and employment much more closely than what we are currently.
I had a feeling you'd have the answer to that. That was well done, Dr. Staten. Thank you for that, Sarah. We have more questions standing by and more answers from the experts. We're taking a break. Be right back. Welcome back to Recover Northwest Town Hall. I'm Steve Dunn. If you're just joining us at this 6:30 hour, we're talking about COVID recovery, not just on the addiction spectrum, but the community overall. We've had a terrific discussion already. We're going to continue it now with Deb Knapp. Another question, Deb.
Yes, as you can see, we have our panel of people asking questions of the experts tonight. I want to turn to Brent Botros, who works with addiction treatment, a recovering addict, but focuses on fitness style therapy and addiction counseling. And Brent, you have a question about how things are being handled. Go ahead.
Yeah, so first of all, thank you for having us. Tony, good to see you again. And, you know, I think we've already touched on some of the fallout that we've seen from COVID as far as addiction, isolation, and even overdose is concerned. But I'm more so curious about what have we as professionals in the field done to really step up our game and address these issues? And then second part, where do you guys see that we can improve? And then the third part, how can we improve?
Some great questions there, some self-analyzing of what's happening, Steve.
Well, let's check with Tony Besnan now. Tony, you heard his questions. What's being done right now to deal with all these issues, particularly with things like isolation right now and COVID recovery and addiction recovery? What is being done from your field and the experts' field to handle this and to kind of move forward and help some of these folks who are stuck in this?
Yeah, and I think I'm going to answer this question in a different way. So I think there's a lot of really good professionals in the field. There's a lot of really smart individuals and organizations working to try to address these issues on the ground floor. But what we really need right now is we need a high-level, coordinated effort at the top of Oregon, right? We need our most influential leaders, like let's say like the governor, for example, to really start helping move the system where it needs to go. There's a lot of disparate efforts happening right now. There's a lot of really good people, and the facts are that there's more money coming into the system that's ever been here than before, and we're in the middle of a behavioral health workforce crisis where people are dropping out of the field and programs are shutting down, while we're also experiencing substance use that's been exacerbated by the pandemic. And what we really need, to be frank, is we need the Alcohol and Drug Policy Commission strategic plan, the statewide strategic plan, to be fully implemented. You know, in 2017, Governor Brown declared addiction a public health crisis. Now, after that, of course, we've had the pandemics and the fires, and so a lot of energy and time has been diverted for good measure. I'm not saying it isn't, but we really need high-level leadership at the state to help push the system forward where it needs to go rapidly. I mean, 90 people have died so far this year in just Marion County, and I know a lot of people who have died, you know, and it's not right when there's solutions available to us. So I would say, you know, Brad, good to see you. Keep doing what you're doing. I'm going to keep doing what I'm doing. What I'm witnessing across the state is that everybody's starting to coalesce around the need for a rapid strategic response to this issue to address the crisis and meet it, you know, in the intensity that it's unfolding.
Thank you, Tony. I can tell you from a news operation, that's something we will look into after this program is over. What is being done from that standpoint from the state of Oregon? I remember Governor Brown talking about that. As you mentioned, so many things have happened in this state since then that perhaps put it on the back burner. We'll see what's happening next. Let's go back to Deb Knapp now. Deb.
Our next guest we want to feature tonight is Bradford Corbett. He's a Blanchet House resident, addicted to drugs and alcohol since the age of 13, but currently studying to become an addictions counselor. So we want to hear from you, Bradford, on your question tonight. Thanks for joining us.
Thanks for having me. My question is, how can people who have limited health insurance receive ongoing mental health treatment? Now, I've been treated before in different locations, and what I've noticed is that once a patient is stable, they are let go from the hospital and with little or no treatment plan. And how are insurance companies dealing with that? Because insurance is the main thing in order to get ongoing treatment for anything.
Continuing services, yes.
Yeah, great question for Dr. Jim Polo. You heard him. You know, a lot of folks out there, limited resources. How do they continue to get the help that they need, Doctor?
Yeah, it's a difficult question, and it's a difficult question for everybody, not just people that don't have insurance. So the first thing I would say is that it's important to recognize we have to all work together. There are many different resources in the community. We have to take an effort to educate people on what the resources are that are there. And for the folks that are needing help, we have to do a better job of helping to coordinate those resources to make them available and effective. At Regents, one of the things that we've recognized, you know, as an insurance company, even though we put a lot of resources into the people that carry our insurance, we have actually devoted a tremendous amount of resources contributing to rural communities where resources don't exist for those people. So working with nonprofits directly in those communities on things like homelessness, people that don't have food, people that don't have jobs. If we've learned nothing from this pandemic, if we've learned anything, it's that we have to all work together. Everybody has to have, you know, access if we're going to survive as a community. And so I think it's important to think about how we coordinate the things that we have and then work with the state to make sure that we have an equitable approach to making sure that we don't neglect those communities that in the past have been neglected.
Absolutely. Those rural communities, they're just crying for the help over there. So we appreciate that from a region standpoint as well. Deb Knapp, let's go back to you.
Well, at the top of this special program, we introduced you to Bailey Cunningham, who's sitting with her mother, Becca. Becca, joining your daughter. Thank you for supporting her and joining us on this program tonight. What is your question?
So I've just noticed that masks and vaccinations have really become such a divisive and controversial issue during the pandemic. And so I'm looking for suggestions for how we can move forward to cross these divides in our personal relationships and then in our communities.
Certainly has caused some strain on many personal relationships. So Steve, that's the question tonight from Becca.
And it's a good question, no doubt about it. Deborah Diedrichs, I want to bring you back in, of course, Director of Crisis Line Operations, Lines for Life. What are your thoughts on that question?
I think that everyone needs to be intentional about their own self-care, and everybody has a different risk tolerance, and I think we're all navigating that all the time these days. I mean, I think that in terms of bridging the divide in people with different perspectives on vaccinations and masks, that what I would recommend would be to understand that we're all scared, okay? Everyone's afraid, and everyone's trying to do make the best decisions possible for themselves. And I think that if we can understand what's underneath, like what's going on inside, and really listen to hear what's going on and give people a chance to talk about where they're coming from with those decisions that they're making, then we have a better chance of learning from each other and holding on to those connections that are so important during this time.
Certainly has been a point of contention. All you have to do is get on social media and you'll see folks who say, yes, wear a mask, don't wear a mask, get vaccinated, don't get vaccinated. And then you see the fights that occur after that. And certainly that's causing stress in and of itself, Dr. Staten, right?
I agree. And I think one of the things that I just want to throw out real quick is that one of the things that masks, mental health challenges, and substance use disorder challenges all have in common as far as how we support people is we need to meet people where they are. Stigmatizing and making people feel badly about where they are, it doesn't work. And so one of the things that I would recommend, whether we're talking about somebody who needs help for their substance use, somebody who's struggling with their mental health, or if it's a conversation about masks and vaccines, understand, be curious, try not to be judgmental, and just meet people where they are to the best of your ability. People have the right to make decisions. And I also find that if we take a moment to meet people where they are and they're more apt to hear us, they actually might be more apt to listen. So I would again just recommend meeting people where they are, try not to stigmatize, and keep the conversation going. As long as you're having conversations, there's always a chance for change.
And I hope they listen to what you just had to say as well, Dr. Staten. We're going to take a break. When we come back, we're going to hear from one of our viewers. Question from them coming up. Welcome back to Recover Northwest Town Hall COVID Recovery. In any town hall, I like to hear from as many people as we possibly can. For that, let's go to Deb Knapp. Deb.
Well, in addition to our panel of guests that we've been hearing from all evening tonight, we also went out into the community to see what you were thinking. Here's a question from Evan Tondo.
What can we do to get ourselves back in the swing of things with the understanding that things may just be like this for the unforeseeable future? So what can we do to adjust ourselves back into the new normal? I know everyone got sick of hearing that, but I think that really is what it is.
Boy, that's the big question, because so many people out there, we've gone through this now, 18 months, said Dr. Polo, and people think, is this the new normal? We've got this new variant, and then another couple of months will be another variant. Is this something we will have to get used to? And if so, how do we do that? Your thoughts on that?
Yeah, you know, it's a great question, because we actually have been adjusting to the new normal even before the pandemic. Life sends things our ways. It changes, how we live. It changes what we do. We're always adapting to what's going on. It's just that now we're adapting to something that's really significant that affects all of us. Part of it is accepting the change, letting go of the things that you really valued that maybe are different now, honoring what that was, but accepting the fact that maybe some things are going to be a little bit different, and kind of taking, control of whatever that might be. The example that I sometimes give young kids is, hey, you don't control whether or not somebody tells you to wear a mask. But maybe what you do control is choose the mask you want to wear. Make it a game, make it fun. Choose your favorite sports team or your favorite superhero. So, we're going to have to adapt to a lot of things that are still coming, and we don't know what they all are. But if we look at it as an opportunity to think about what it is that we do control and kind of accept the fact that things are going to happen that you can't control, it makes it easier to just live with whatever is coming down the road. I actually think we are heading in the right direction. I don't think we're going to be wearing masks forever. I don't think we're going to be social distancing forever. So, keep in mind that at the end of this, there probably is going to be a lot better of a new normal that everybody is talking about.
Let's hope so. This world just keeps on changing in the meantime. Let's go back to Deb.
Good advice. Control what we can, right? Rob Strain joins us now, and he describes himself as a 46-year-old father of a 15-year-old son. He's a husband and proud member of Portland's recovery community. Rob, what's your question tonight?
Hi, thanks for having this discussion. COVID has our hospitals max capacity. Portland's detox centers, our treatment facilities, they're all at max capacity. You have private treatment centers who accept private insurance that have open beds. Is there a way to creatively get like Oregon's COVID relief fund to help privately fund some of these folks who may have had insurance before the shutdown to get help with private treatment centers like Treehouse?
Getting some help from the treatment centers. Good question. Dr. Staten, that's in your wheelhouse, of course. Is that something you'd like to answer?
Possibly. I might be able to answer this. I'm not 100% sure, but I'll try. There's different things that might be able to be done. For example, contacting the coordinated care organization that you might be under, whether that be HealthShare, whether that be Trillium, and seeing if maybe you're eligible for those health insurance benefits again. Sometimes people lose benefits and they're able to get them back, and so that might be something that I would suggest. Multnomah County sometimes will work with providers for whom we have contracts and say, hey, maybe there's Multnomah treatment funds that we might be able to help with. I think the biggest thing is that when people are ready and treatment services are not available, we have lost an opportunity to really engage somebody in services. So I think what I would recommend is if you don't have insurance or if you've lost benefits, contact your coordinated care organization, contact Multnomah County, contact us. Your providers, contact them and say, hey, what funds do you have available? Do you have a sliding scale available? Because many organizations are not in places where they're going to turn you away. Some people have policies that say what you afford to pay is what you're going to pay. So I would say do your homework, find out what the organization you're trying to get services from, what their policies are around funding or indigent funding if you need that. Contacting your coordinated care organization to find out if you might be eligible for those benefits. And no matter how challenging things get, and this is going to be really easy to say and really hard to apply, please do not stop. Recovery is hard enough on its own, and I know there's barriers that always come up, but please keep asking questions. Please do not be discouraged. We will find a way to try to get you help, but just keep asking questions. And coordinated care organizations, Multnomah County, reach out to us and let us know if there's ways that we can be of support to you.
That's the positivity we need to hear on a program like this, Dr. Staten. So thank you for pointing that out. Is just absolutely do not give up. Deborah Diedrichson, I want to bring you back in here. Your advice on that, because we hear from people, they say, well, I just don't have the resources. My insurance ran out. What do I do, and who can possibly help me? I want to hear your thoughts on this.
Yeah, I mean, I think when you're crashing emotionally or you're hitting bottom with an addiction, it's hard to navigate that system of resources. So I really just want to reinforce what Dr. Staten was saying, that, like, for example, the Drug and Alcohol Helpline that Lines for Life operates 24/7, 365, you can call in and we will support you emotionally. And sometimes people need that chance to just get it all out before they can even think about or concentrate on connecting with resources. And I just had a situation last week where I was talking with someone via text, and they were in this situation, and we ended up calling several treatment centers together. So he and we did a conference call, and I supported him in navigating that system, and that really made a big difference. I also just want to mention that Lines for Life now has a behavioral health support line that anyone who lives in Oregon who's 18 years of age or older can get 3 free telephone counseling sessions. And part of the goal of those sessions is we provide that immediate help, but we're also working on connecting that person with resources, with ongoing treatment resources, being that bridge. So that number is 1-800-923-4357. And I think sometimes when things are really rough in your life, it's hard to think straight. And so just if you pick up the phone and call the helpline or Multnomah County Crisis Line or the Lifeline, Lines for Life now has a racial equity support line that we're running Monday through Friday from 10 a.m. to 7 p.m. That's answered completely by clinicians who identify as people of color. So if you're in a community, you identify as a person of color or someone from a marginalized community and you need some support around that, we're available. So I just want to reinforce what everyone else is saying, that, you know, addiction is a health issue. It's not a moral issue. I really want to bust through stigma. And yes, it can be challenging to connect with treatment, but if you don't have insurance, you can call a helpline and there are people who will help you connect with the care that you need.
And that's exactly why we do this program too, Deborah, is to bust right through that stigma. Thank you very much. Excellent point. We'll continue after this. Our Recover Northwest Town Hall COVID recovery continues now. We're down to about our last 3 minutes of the program. I want to get as many questions as we possibly can. Let's go back to Deb now.
Well, this is beyond the addiction recovery, of course, COVID recovery and the mental health fallout that we've seen from that. I want to turn our attention back to Bailey Cunningham to hear from the youth in our community, and another question from you, Bailey.
So teens often turn to vaping, drinking, or smoking or drugs as an alternative to other healthy coping mechanisms for stress relief. Can you recommend some healthy coping mechanisms teens can use as an alternative?
Great question. Thanks, Bailey.
Yeah, healthy coping mechanisms. Let's go back to Tony Vesna for that. Tony, you've been through it all in your life. What advice do you have for her tonight?
Yeah, so I would say that, you know, looking back, I needed to have more connection with my peers. I needed to feel like there was hope for me moving forward. I needed to feel like my dreams and aspirations were attainable, and that I had purpose and meaning, you know, on this planet, which I didn't growing up the way that I did. So I would say, you know, find those things in your peers. You know, there's a couple youth programs like Youth Era, for example, and they're doing some really cool stuff, like on, I think it's Twitch, I believe. It's like an online gaming platform. They're doing cool stuff on social media where people can connect and use those tools in a way that's healthy. You know, and I'm not going to go to the just say no thing, but I would say that, you know, it would be good for young people and parents to embrace the fact that people experiment and they use, and some people get addicted and they need help, and that's okay. What I often see working with young adults and parents is this need to get over this hump, and this hump is the stigma of their kid having an addiction issue before they can get help. Like, nobody wants to talk about it, nobody wants to recognize the fact that it's there, and because of that, people wait. And right now is definitely not a time to wait, because you know, there's fentanyl that's coming in, you know, to the metro area pretty heavy in the form of pills. And so a lot more people are using these pills, and they're more acceptable. You know, when I was young, like, the thought of using heroin was like a needle and a spoon when I was a really young kid. And that wasn't like something that I was going to do. But now it's like taking a pill, like a blue pill. And so I think we need to do a lot of education. I think we need to increase our resources to preventative efforts. Right now, the state spends less than 1% of all of its addiction dollars on prevention. We need to invest in prevention, and we need to go and ask the young people on this call. Like, if you're a young person who called in today, that leads me to believe that you're a leader in this issue, and we need to empower you and ask you, what are the things you feel you and your people need to do as alternatives, and then help you make those things a reality.
Good advice, Tony. Unfortunately, we are out of time. We're just getting started with this discussion. So many folks dealing with issues right now in this COVID era. We'll keep talking about this, get the communication out there. But again, thanks to all our experts and our guest today, Deb Knapp. Thank you very much. Thank you for watching, everybody, and good night.
This Recover Northwest special was sponsored by Regions Blue Cross Blue Shield of Oregon.